Hello guys, thank you for being here with me again on my channel. This is another interesting case. Actually, I have a series of similar lesions, and I really like to present this case to you because it is not so often possible to see this pathology. So another young athlete, 14 years old I think, but what can we see? There is some bone marrow edema around the growth plate. There is a small line here, maybe an older Salter-Harris fracture, but no cortical involvement, and there is clearly no bone marrow edema around this line. So if it is, it's probably old, but I can see there is a difference between the metaphysis here and the metaphysis here. It looks traumatized, probably acute, but it's not impossible to say that this is a chronic state of overuse. And the problem is that the pain of the patient was on the medial side of the tibia, and at first I missed this. I thought this was an artifact, but actually it's not. So what is this? This is a subperiosteal haematoma, which we can appreciate very well on these axial sequences. You see a semilunar collection of fluid and blood on the surface of the medial tibia, and this is the periosteum, and between the periosteum and the bone is this collection. Okay, where does it stop, this collection? This collection stops around the metaphysis. So we can only speculate about the source of this subperiosteal hematoma, probably due to shear forces on the medial metaphysis, and there was some blood coming from here and went upwards, but it's not impossible that he had a direct blow here, but not so clear because there is no bone marrow edema here. So if this is a trauma of the metaphysis, then this is a Salter-Harris type 1 fracture. Okay, and I think this should be ignored because it's probably an older lesion. Other injuries, there is also another trauma that actually I've noticed first when I was reading the exam, but then the orthopedist told me that the symptomatology was on the medial side, not on the lateral side. So you can see this area of bone marrow edema here on the fibula, on the lateral side and anterior side, and there is a small irregularity of the cortex, and there is also periosteal reaction. This is not actually a hematoma but a periosteal reaction on this side, probably a small impaction fracture, and in being a young patient did not actually fracture. So this is another interesting pathology on this patient. Bone marrow edema here around in middle cuneiform bone. What can we appreciate? Also, we can discuss that ATFL is normal, PTFL is normal, fibulocalcaneal ligament is almost certain normal because ATFL is normal. So let's try and find this ATFL. Here it is. It's coming here. Okay, it's difficult to prove on these sequences that it is intact, but here it is. It's doing sling like a hammock under the peroneal tendons coming from here This is the fibulocalcaneal ligament. This is peroneal tendon. This is one peroneal tendon, this is the other one. Okay, and if we see this, here it is, and here it is, you can always better appreciate this ligament on non-fat set sequences. Okay, in terms of anatomy, you can very well depict here the posterior tibio talofibular ligament, PTFL here, and the posterior syndesmotic ligament, fibulotibial ligament. Okay, can we also appreciate on this sequence is this small bone inside the distal part of the posterior tibial tendon, which is a small navicular accessory bone. This is it. This was the case number 49, subperiosteal haematoma on the tibia, and probably Salter-Harris type 1 type of fracture on this part. Thank you again for watching me. Please subscribe to my channel if you want to be informed of my future lectures or tutorials. Thank you. Bye.